What other health problems? Diabetes. And what happens with diabetes is that, remember I said your stomach or your esophagus should be doing this kind of thing to push the food down, then it should go into your stomach. And what happens with diabetes is instead of kind of going like this, it's going like this. So it's going slow, so it's taking a long time to empty all that out. So instead of that 2 hours of getting everything out, it's taking 3 or 4 hours to get all that food down into your small intestine. Like I said, scleroderma, some of the other rheumatoid diseases that people have, where their esophagus changes, instead of being this nice thing going like this, it just becomes a smooth pipe, so it can't push things through and move things on. Some people may have spasms of their esophagus, and they have a hard time with things because things aren't moving well, and all of a sudden it spasms, and as it's spasming, things might start heading back up again. So a lot of people with asthma have acid reflux. And we learned in our own practice that when we can't control someone's asthma, they're on every medicine we can give them for asthma, that if we treat their acid reflux, their asthma gets better. Yeah. Yes?
I take lansoprazole, however you pronounce it, twice a day.
Mm-hmm.
And then I've read a lot of articles where the antacids can cause cancer.
Mm-hmm. So we're going to deal with that at the end. We're going to talk about those medicines. There are some medicines specifically that can cause acid reflux. Theophylline. Anybody on theophylline? A couple people might be, because I use it sometimes for kind of later on. Too much albuterol. We use a lot when you have an asthma attack, you have a COPD attack, you have to use a lot of albuterol. That loosens that sphincter again, so the theophylline kind of opens those up and you can get acid reflux. Calcium channel blockers, anybody on diltiazem, verapamil, those kinds of things loosen that sphincter again and let things shoot back up. Again, diabetes slows things from emptying, so keeping the diabetes under control will help that. So it's not the diabetes medicines that make it happen, diabetes medicines can make it better. So I want to talk about cough for a minute, and then we'll get into the COPD and the pulmonary fibrosis. So a lot of what we see in our pulmonary practice, we see a lot of people that refer to us for this cough that just won't go away. And we end up with acid reflux. And people think they're crazy when they come in. Yeah.
When you talk about this cough, are you talking like a throat cough or chest cough?
And so we have to decide when you're in the office with me and we talk about it, it's more of a throat cough.
Okay.
And some people have to decide, especially like asthma and that kind of thing, is it my throat cough going on up here? Is this my vocal cords? Is this the LPR going on? Or is this down here because my asthma, my COPD, wheezing kind of thing? Which one is it? So sometimes as we kind of sort through the whole thing, we talk about it and people kind of pay attention more to it and they go, oh yeah, this is coming from here, so my albuterol is going to work. Because quite often the story will be, I'm wheezing, I'm coughing, I'm short of breath, and my albuterol is not helping. That's because it's coming from up here, and albuterol is not going to help this. Albuterol is going to help down here in your chest, because we're going to open up the airways down here, but if it's just all acid being sloshed around up here, albuterol is not going to help that. So people who have LPR bad enough, sometimes we have to send them onto a speech therapist to learn how to control and relax these muscles up here so that they can work on that. And some people, you can hear them coming down the hall. You know, when people first come in with this ongoing cough or whatever, I can hear them wheezing and coughing and carrying on, coming down the hallway. And I put a stethoscope in their lungs and on their chest, I don't hear anything. But if I put a stethoscope up here, I can hear the wheezing going on. It's, again, everything's getting washed up here into those vocal cords, that LPR. So, so cough, we have to tease it apart. And it takes a long time to fix the cough. And people come in, they tell me I'm crazy, because they're like, no, it's not acid reflux. It can't be acid reflux. I don't feel anything. I'm coughing. Please make my cough go away. And we go through it, and we go through everything, and over time, the cough starts getting better. And they're like, oh yeah, that must know what it is. And as visits go on, like, I don't hear you coming down the hallway anymore. Because that wheezing and all that stuff up here gets better. Because it can be associated with what's called vocal cord dysfunction. So the vocal cords get irritated, and then they just start spasming and doing their thing, and they just need to be relaxed. And so when we're talking about a cough from LPR, first we have to get rid of the acid, and then everything has to heal. So it can take months for that to get better. Where for the asthma, usually if we can get that reflux going treat it pretty quickly, we can get their asthma back under control better. So COPD, you missed my great slide on COPD and acid reflux. It had 2 lines. And so everybody who came here to hear about COPD and acid reflux, you got 2 lines out of the whole thing. And everything I read, because I kept trying to figure out kind of where we're going to go with this, everything says the same thing. Acid reflux worsens COPD. What causes more COPD flares? Every single article has about this much. Acid reflux worsens or causes more COPD flares. I'm like, great, can we get beyond that? Nope. So we know that people with acid reflux, people with COPD, the people that had acid reflux associated with it, which is a large number of people actually, those that had COPD and had acid reflux had twice the number of hospitalizations as those people that didn't have acid reflux, all from their COPD flaring. So it goes back to we need to treat the acid reflux in addition to treating your COPD, especially if you're someone that has a lot of flares of your COPD. The piece we're missing in there probably is acid reflux. So what's going on with that? The thoughts are, and there's no clear answer of what's going on, but the thoughts are you have the acid reflux, you might be having some of the acid maybe dripping down to trachea a little bit, irritating those airways, which is probably what's also going on with asthma. So the airways are already irritated with COPD. And then you add something else, a little bit of acid that keeps dripping in there every so often, it just sets them off all the time. They just can't heal to get better. In addition, with COPD, you're breathing hard. And every time you're breathing hard, it's like that, the sleep apnea, it's not to the same effect when you go like this, but when you're breathing hard, you're pushing more and those pressures, and so you're pushing stuff up every time you're doing that. Plus, you take albuterol, which is relaxing that sphincter down there, which is giving more chance for everything to kind of go up. So is acid reflux causing COPD, or is COPD causing acid reflux? They couldn't really figure out. Anything I read couldn't put one before the other. It really is. It sounds like it's a combination kind of thing. We need to treat both together. In pulmonary fibrosis, on the other hand, we're not sure which one comes first, actually. So the thought is in pulmonary fibrosis that it could be worsening pulmonary fibrosis, or did it start causing some of the pulmonary fibrosis? We aren't clear. A large number of people with pulmonary fibrosis also have acid reflux, more so than even in COPD. So is there a correlation there? And I was trying, and I have to say you didn't miss this picture because I couldn't come up with a really good picture. I was trying to get a really good picture of pulmonary fibrosis and some aspiration on a CAT scan. I couldn't find the picture I really like to share, so you didn't miss that. But when you have pulmonary fibrosis, you have a lot of scarring in your lungs. And the scarring is not reversible. Once the scarring is there in pulmonary fibrosis, we can't make it go away. And for people with idiopathic pulmonary fibrosis, there's 2 medicines that have come on the market that slow the progression, but in general, we have no treatment for that. So what can we treat? Can we treat something to try to improve things, or try to slow progression, try to prevent some scarring? Perhaps. So perhaps what's going on is you're having some what's called microaspiration. So when you aspirate, it means the acid reflux is coming up, or the secretions are coming up and dripping down into the lungs a little bit. They're getting inhaled. And it could be acid, because you have acid reflux. It could just be food particles going up. It could just be bile going up in there that is not acidic, but is constantly irritating something back there in the lungs. So is that causing constant inflammation, and that inflammation then moves on to scarring and becomes pulmonary fibrosis? Or is the pulmonary fibrosis causing people to have more acid reflux and causing the whole cycle to go? We don't know. A lot of people with pulmonary fibrosis also have a cough. Anybody in here have their cough with their pulmonary fibrosis? Yeah. So the question is it the pulmonary fibrosis causing the cough, or is it acid reflux, LPR, causing the cough? So the same kind of thing. But when they did studies, when they treated acid reflux in people with pulmonary fibrosis, it didn't improve the cough, did not improve the cough. Where we can improve the cough in COPD and asthma and people with cough, when we treat the acid reflux, we can make that cough go away. But we really don't get far in pulmonary fibrosis and cough when we treat acid reflux. Does that all make sense? So what can we do to treat this? Pretty much, we're treating the COPD with all medicines, we're treating asthma with all medicines, we're treating pulmonary fibrosis maybe with some medicines, kind of depending. And perhaps when you're having a flare, if we give you steroids or whatever, decrease inflammation, maybe we're treating something there. But let's talk about treating acid reflux. So it really comes down to treating the acid reflux. So you have to go through back to that wonderful list of all the things you can't eat. So no alcohol, no chocolate, no caffeine, no carbonated beverages, and that means like no ginger ale, none of the little bubbly sodas that are bubbly waters that are out there now, no seltzer water. Because think about the teenage boys. They ingest all the soda because they love to see if they can burp. So as I was talking to my son about making the doing my thing, I said, because he loves to walk around burping all the time, I said, maybe I should start with a little video of you so he can give me some great examples. Okay, I'm done with my talk. We can stop this. No alcohol, and that means even a glass of wine with dinner. No caffeine, no carbonated beverages, no high-fat foods, so no fried chicken. You have to bake and fry your foods. Nothing with tomatoes. I know it's tomato season, and everybody is like, I keep telling people you can throw darts in my picture after you leave. Please don't do it in the room with me. You gotta get rid of the tomatoes and the tomato-based products. So lasagna, spaghetti. You can still have spaghetti noodles, but you can't put tomatoes in.
You just give us a list of things we can eat.
Well, that's what Felicia said.
Vegetables.
I've had people refer to as a stick and twigs diet. No spicy foods, no uncooked onions. You can have cooked onions. Garlic for some people causes acid reflux. No orange juice and grapefruit juice, and many of your medicines you can't take grapefruit juice with anyway. No chocolate, that's a tough one for people. No peppermint, and includes peppermint that you're sucking on, because people are like, well, my mouth's dry all the time, my spirea or whatever, I need to have something, and people will suck on a piece of peppermint candy. Well, again, as soon as you put something in here, you're triggering the whole system to start gearing up for what it's supposed to do.
Spearmint also.
Yeah, spearmint's on the bad list too.
Because it's in toothpaste, it's so hard to find toothpaste.
Yeah. So you gotta look at all those things. And if you can get all those things out of your diet for at least a month, and you're seeing improvement, then you can add things back and see what triggers you.
About nuts.
Nuts, as long as you're not high fat nuts, you're okay.
Like almonds, right there.
How high in fat are they?
Well, I don't know, but they're supposed to be good for you.
You need to wait 3 hours from the last time you meet and when you lay down. That includes lying on the couch. You missed my good picture of Homer lying on the couch with his belly sticking out later. Waiting 3 hours from the last time you lie down, including lying down on the couch to watch television. It includes, most people think of after supper, but it includes if you take an afternoon nap. If you eat lunch at noon and you decide you need to take an afternoon nap on the couch, you gotta wait 3 hours because we want everything to move out. And as long as there's something from here to here, things are moving and making juice, making acid. So your stomach needs to completely empty out to get the acid shut off.